Mr. Speaker, members of the board, delegates, and colleagues, we have witnessed, even in the darkest days of this pandemic, the brilliance and resiliency of our fellow physicians. Time and again, through hardship and setbacks, through surges and lockdowns, against a rising tide of anti-science rhetoric and political grandstanding, physicians rose to the extraordinary challenge of COVID-19. Physicians stood tall, and the AMA stood with them. Through the struggles of the past year, we saw a renewed and vigorous AMA, an AMA that's more nimble and more focused, one that not only gives voice to the urgent needs of physicians in a crisis, but through science and advocacy, provides expertise and support to empower physicians to meet any challenge. When physicians needed an ally on their side against COVID-19, they turned to the AMA, and the AMA delivered. We may never in our lifetime see another threat to public health, the size, the magnitude, and complexity of COVID-19. Let's certainly hope we don't. But it didn't take a global pandemic for the work of the AMA, for our strategic arcs and accelerators, to resonate with physicians, with medical students, and residents. I'll share 3 slides that illustrate how far the AMA has come over the last decade, and that clearly demonstrate our growing influence on both healthcare and public health. This year, the AMA celebrates 10 years of steady growth among dues-paying members, as shown here. In terms of raw numbers, AMA membership has grown by more than 1/3 since 2011. In fact, dues-paying membership increase in 2020 was the greatest year-over-year jump in the last 70 years. That's 70 years. This remarkable feat is the result of a focused strategy to build our reputation and create multiple physician points of engagement across our newly developed digital channels. And it reflects both a recognition of our success, but also a validation that our strategic arcs of removing obstacles to patient care, of driving the future of medicine through improved education, training, and innovation, and of leading the change and charge to prevent chronic disease. These are right on target. This is the work the AMA does day in and day out, even in a pandemic, to improve both the clinical environment and patient outcomes, to build practice sustainability, and to elevate the concerns of our physician community to those who can lend a hand. These aren't easy lifts. Rather, these involve big seismic changes in healthcare that the AMA confronts. And physicians, by placing their trust and support in us, see the AMA as their powerful ally in patient care. Slide 2 highlights the AMA's growing leadership on issues concerning public health. In a year defined by a once-in-a-lifetime health crisis, the AMA was the leading nonpartisan voice in 2020, as measured by our share of voice. We were first among all other associations in healthcare or public health. Share of voice is a standard metric factoring in an organization's media exposure. What these data reveal is that on any given day last year, if a worried parent, a business owner, or caregiver turned on the news, or read an article, or scrolled through their social media feeds in order to better understand this novel virus, that person was more likely to hear from the AMA than from any other health or public health association. With daily COVID videos, podcasts, and a robust digital presence online and through AMA News, AMA's website recorded 20 million unique visitors in 2020. That exceeds the combined totals from the prior 2 years. Additionally, online traffic surged 40% across the JAMA network thanks to an expanded digital presence. The public and physicians also benefited from AMA's COVID-19 Resource Center, which provided insights on COVID diagnosis and treatment, vaccines, and other critical information for physicians to share with their patients. Slide 3 shows the core strategy that has performed so well. Our 3 strategic arcs, shown in the inner circle, each are propelled by our 3 shared accelerators, represented in the outer circle. The accelerators in that outer circle are innovation, advocacy, and equity. Now, the AMA's historic work on advocacy is really well known, and you'll also be familiar with AMA's innovation ecosystem, sculpted over the last decade. In fact, the AMA was named Digital Health and Innovation Nonprofit of the Year for 2020 by an influential group of technology and business leaders. In addition, CB Insights, which provides market analytics to companies and investors, named their top 27 corporate innovation labs in healthcare for 2020. Health 2047, our independently operating innovation company in Silicon Valley, ranked second among this distinguished group. A more recent area of concentration, our 3rd accelerator that also touches on all 3 strategic arcs, is our effort to advance health equity. An effort which, like other elements of the strategic framework, is rooted in the policies adopted by this House. Last month, the AMA released its strategic plan for the Health Equity Accelerator, which lays out 5 strategies needed to move toward a more equitable health future. These include 1, embedding equity and racial justice throughout the AMA by developing anti-racism and equity practices, programming, policies, and culture. 2, building alliances with historically marginalized physicians and other stakeholders. 3, pushing upstream to address determinants of health and understand the root causes of inequities. By focusing upstream toward the origins of inequities, this work takes us squarely into the public health arena. 4, ensuring that equitable structures and opportunities and innovation are reflected in AMA's efforts to advance digital health. And 5, fostering pathways for truth and reflection through honest conversations about AMA's past, to define and understand how our own policies and practices through history have contributed to the unequal health system that we see today. Why? Well, in order to advance equity, we have to understand how we arrived at this current state. Just as the accelerators of advocacy and innovation were years in the making, the AMA's strategic plan on equity is the result of 2 years of preparation led by our Center for Health Equity. Now, the AMA is neither first nor alone in dealing with health equity as a core strategic element. Many organizations have worked against inequities and injustices in healthcare for decades, and the AMA has voiced concerns in these areas as well. But now we are intentional and deeply committed to this work. It is part of our core framework. Toward this end, our ability to build alliances and to bring partners to the table across healthcare and other sectors is a strength that we will deploy for this purpose. Our AMA envisions a nation in which all people live in thriving communities with a health system that values people equally and treats them equitably. We strive for all Americans to have access to meaningful, high quality, and safe health care. But in the absence of equity, how can we possibly ensure optimization of access, quality, and safety? Through this plan, we will develop and provide physicians the tools, resources, and the understanding needed to identify and address inequities in their community of patients. Now, obviously, change in healthcare and society won't happen overnight. It will take a continued effort by many, individuals and organizations, working in coordination and toward the same goal. The late Peter Drucker, the celebrated business strategist, once said that, quote, "Management is doing the thing right, but leadership is doing the right thing." Our mission to promote the art and science of medicine and the betterment of public health very clearly defines the right thing. And our policies define it with both clarity and even more granularity. Through achievement, share of voice, growing membership, national recognition of our work and our 3 ARCs and 3 accelerators, we further strengthen the AMA's position of leadership. But how do we continue to increase our impact? Well, we do so through the hard work of doing what's right. Thank you.